Good morning. We're on Eastern Standard Time for some of our invited-in guests. I'm Sally Heyman. I'm very privileged and proud to be a Miami-Dade County Commissioner and welcome all of you to Miami-Dade, a lot of hometown people and some exceptional guests. And partnering today with me is one of my favorites in the judiciary, sorry Judge, Judge Steve, there you go, Judge Steve Lifman, and together we are kicking off, breaking out, stepping up. In addition to the hat I wear locally, I am also Vice Chair of Justice and Public Safety for the National Association of Counties. And with that comes the ability to share ideas, have collaborative efforts, and tackle a national problem that is not just here at home plaguing us, that has a champion like Steve, our jurist, and our criminal justice system, but nationwide is a problem that is overwhelming. It is almost epidemic, staggering the burden that we have of mentally ill that are literally being left in our holding facilities, our corrections facilities, for lack of a better place to put them, and at a staggering cost to us as a community and the poor souls that are succumbing to this because there virtually isn't the services necessary and needed in those corrections facilities. Their primary responsibility is public safety. Our primary concern is treatment for them and making them useful and productive and safe to be back on our streets. With that, I welcome you to this important event. We have numerous speakers and participants, and most especially significant partners. We're going to do the press conference, but before I bring on our second speaker, our first speaker for you, I want to take the privilege that says it starts from grassroots down with our CIT officers. If you will all rise, these are the crisis intervention team of our police departments. Thank you. And we capped it at a couple instead of the 4,500 plus that have been trained here in Miami-Dade. And you will hear from Steve because it starts with them literally on the front line and how they handle people with mental illness. Also, our local levels, some of my colleagues are in a committee meeting across the street taking care of county business, but we have representatives from some of my colleagues on the county commission. And yesterday, they passed a resolution unanimously in support of a commitment for the activities and obligations for the Stepping Up project. And lastly, our partners at the federal level. We have a representative from Congresswoman Debbie Wasserman Schultz and other Congress people who will be in and out during the day. We have federal legislation that has been written, and partnering with our NACO colleagues nationwide, we will be getting co-sponsors and hopefully have a meaningful piece of legislation. With that, I'd like to introduce a colleague of mine. He represents Leon County as a county commissioner. He is second vice president to NACO. He is a force to be reckoned with when it comes to applying common sense into legislation. My friend, Brian Deloge. Welcome, Brian.
I don't know about a force to be reckoned with. I mean, Sally Heyman, really? I'm Brian Deloge. It's an honor to be here today. I'm a Leon County Commissioner. I'm past president of the Florida Association of Counties, and today I'm here representing the National Association of Counties. I'm incoming president or second vice president of the National Association of Counties, and we're real excited about today's conference. We've got a chance to partner with some people. The counties represent, frankly, where the rubber meets the road, and we see $70 billion a year being spent on not only health care, but another $70 billion a year being spent on public safety. And so if anybody sees at the end of the day where this happens, we're the ground street, we're the people where this really hits us. And we have 11 million people a year that we're admitting to our jails. So we're excited about the chance to talk a little bit about this. You know, as Judge, I'll steal this from Judge Lifman, who the definition of insanity is you can continue doing things, the same things over and over again and expect different results. Today we're going to look at doing things a little differently. And the beauty of government, unlike the private sector, is we share best practices. And so Dade County is doing some great things with their CIT program here. Leon County has a similar program. We've graduated 300 officers, and we're also seeing a lot of the success from that. And so what we want to be able to do nationally with our partners here is be able to talk about what's working and what's not working, and how can we change the model, and how can we move this forward. How can we reduce the number of people with mental illness in our jails, and how can we do a better job of figuring out how to drive that number down a little bit and improve the delivery system that we've got today. So it's a great honor to be here today. We've got a lot of people lined up here. And Sally, I don't want to take too much of your time here except for to say that we're excited and we're honored to be part of the partnership, part of the program. And I would ask that for counties and for states around the country, please pass resolutions or proclamations in support of this, and we want to take all the steps necessary to address these issues in our communities, and we look forward to the Stepping Up initiative to reduce the number of people with mental illness in the jails. So that's all for me, Sally, and it's an honor to be here today. Thank you very much. Appreciate it.
We have some state partners that are here today representing Representative Barbara Watson, Representative Dave Richardson, and of course from our U.S. Senator's office, for Marco Rubio's office. So welcome. It truly is an all-level government partnership. With that, I'd like to bring up Dr. Fred Osher, Council of State Governments Justice Center. Welcome, Dr. Fred.
Thank you, Commissioner Heyman. Thanks to all of you for coming out today. Thanks for the work that you do on a daily basis. The number of people with mental illnesses in our U.S. jails has reached a crisis level. People who deal with the problem every day agree the current approach does nothing to improve public safety, stresses already tough financial situations, and hurts people with mental illnesses and their families. Each year, about 2 million adults will be arrested that have serious mental illnesses like schizophrenia, bipolar disorder, major depressive disorders, and many of those will have co-occurring substance use disorders. The people have been arrested oftentimes for relatively minor crimes, such as loitering or causing a public disturbance, which tends to stem from their illness or their addiction rather from intent to harm. The number of people with mental illnesses in our jails is 3 to 6 times greater than the prevalence rates of mental illness in our general population. In counties across the nation, it's the local jail, not a psychiatric hospital, that houses the largest number of individuals with psychiatric illnesses in that jurisdiction. Jails spend 2 to 3 times as much on an individual with a mental illness than those without, and that this burden strains budgets, burdens taxpayers, and does little to impact the individual in a positive way. Once incarcerated, people with mental illnesses tend to stay longer, same charges, same sentences than those without, and they come back more often, higher recidivism rates. This revolving door serves no one well. There's very little return on the investment of the billions of dollars that Brian alluded to that's spent each year locking people up. Some communities, like Miami-Dade County, aren't waiting for help and are already stepping up. With terrific leadership, heard from Commissioner Heyman, you'll hear from Judge Lifman, other judges that are here in court personnel, law enforcement, and so many others have come together to redesign the system at every level. Training police officers in crisis intervention, thank you very much for the work you do. Properly screening and treating people with mental illness who are arrested, and funding staff to help those released access suitable housing, employment, and health care. We've seen more rural countries across the country joining forces, pooling their limited resources in order to face this problem head on. And as Brian previously stated, while counties are where the rubber meets the road, they can't do this alone. State and local governments are needed to work together in order to improve outcomes. State policies and funding decisions create or preclude opportunities at the local level. Decisions and practices at the local level mean the success or failure of our state policies. And this is not a partisan issue. Republicans and Democrats across the country recognize the importance of treatment over jail. And because of this political agreement, we've never been in a better position to take the next positive steps forward. We must do more to reduce the number of people with mental illness in our jails. The status quo is just not acceptable. Recognizing the critical roles that local and state stakeholders play in supporting change, we have joined together the National Association of Counties. I want to recognize Matt Chase, Executive Director of NACO, and so many of the council people that work hard on this every day. We also joined with the American Psychiatric Foundation, and we at the Council of State Governments Justice Center are forging an initiative with the support of national law enforcement, mental health, addiction groups around the country, also with the support of the federal government with agencies such as the Bureau of Justice Assistance. Stepping Up asks counties to commit to developing an action plan that makes more efficient use of budgets, promotes access to treatment and support services, encourages research-based practices and supports, and the use of jails to advance public safety. Counties and other local legislators embracing the call to action will pass resolutions and cooperative statements, committing to key actions that will lead to real change. The Stepping Up initiative isn't simply about providing advice from afar. County leaders will be provided with tools and resources to tackle the problem. Those with the ingredients to move forward will convene at a summit in the spring of 2016 to receive more intensive training and assistance to implement their plans. People with mental illness and their family members and other advocates all play an important role, encouraging partners in government to embrace the call to action and participating in the dialogue and strategic planning. So this is about taking action at the end of the day. Everyone involved in this issue can play a critical role in this initiative wherever you sit, whether a person with mental illness, a family member, a county official, state policymaker, law enforcement, judges, our legislators, or behavioral health professionals. To those viewers who are watching this via live stream, I encourage you to click on the Stepping Up logo to register and take action and join this growing movement. Our citizens with and without disabilities deserve safe and healthy communities. Let's step up together to make that possible. Thank you very much.
In addition to it being Stepping Up Day in Miami-Dade County, it's Law Day. And I can't thank Chief Judge Bertie Soto for prioritizing this effort today, sending staff to Law Day in North Dade. Our Chief Judge is a champion. To say she gets it is second to none. She has helped fast-track initiatives in criminal justice and the system itself with her administrative judge in criminal court, Judge Nugent Safey. Welcome. Without further ado, the woman who champions our courts and rules, Judge Bertilla Soto.
Thank you so much. What a wonderful day. And I know that Judge Lifman and everyone that's worked with him have worked so hard for this day. And you can't believe it's here, because I can't believe it's here. First, I'd like to recognize the judges that are present. Judge Safey, the administrative judge of the Criminal Felony Division. Judge Robin Faber and Judge Mary Jo Francis, who are both on the lines in the misdemeanor county court criminal divisions. If they could stand, because they're our champions for this population. Thank you so much. And of course, Judge Lifman, who you'll hear from later, who said, "Don't introduce me, I'm going to be speaking." The 11th Judicial Circuit of Florida, serving Miami-Dade County, is the largest court system in the state of Florida and the 4th largest in the country. We have 123 circuit and county court judges that serve a population of over 2 million people in a 2,000 square mile area. The 11th Judicial Circuit has always been innovative in implementing programs to serve and resolve problems throughout our community. For example, we've been leaders in drug court, the first drug court in the country, domestic violence division, landlord-tenant and mediation, parenting and child education, traffic court magistrates, witness coordination, and video jail arraignments and bond hearings. And now we're going to be tackling the mental health issues, which we've been doing for a while through Judge Lifman. I am proud to add to our circuit that it's identified and addressed the issue of overrepresentation of the people in criminal justice system with mental illnesses and co-occurring substance abuse disorders for the past 15 years. Led by Judge Lifman, our Criminal Mental Health Project has successfully worked toward decriminalizing mental illness by diverting people from jail to community-based treatment, supportive services, and housing. The project provides an effective, cost-efficient solution to a community problem and works by eliminating gaps in services and forging productive and innovative relationships among all stakeholders who have an interest in the welfare and safety of our community's most vulnerable populations. Short benefits of this project include reduced numbers of defendants with serious mental illness in the county jail and criminal justice system, as well as more efficient and effective processes to access housing, treatment, wraparound services for individuals entering our community. This decreases the likelihood that individuals will reoffend and reappear in our criminal justice system, and increases the likelihood of successful mental health recovery. The long-term benefits include reduced demand for costly acute care services in county jails, state prisons, state forensic mental health treatment facilities, emergency rooms, and other crisis settings, improved administration of justice, decreased crime, and improved public safety, improved public health, decreased injuries to law enforcement officers and people with mental illness, and decreased rate of chronic homelessness. Most importantly, this project is helping to close the revolving door which results in the devastation of families in this community, the breakdown of the criminal justice system, and wasteful government spending. I encourage other communities across our nation to follow our lead once again and pass resolutions to reduce the number of people with mental illness in our jails for providing similar diversion programs that will help develop healthier and stronger communities. Thank you.
The next speaker is one of my favorites when it comes to great woman of power and jail, all in the same sentence. Our Director of Corrections and Rehabilitation, and the emphasis is on the second part, is Maridel Guevara. And literally, ladies and gentlemen, she inherited a department and facilities that actually had part of them nicknamed the Forgotten Floors. They were floors of incarcerated people who with acute psychotic problems and overwhelming issues to the system that literally were placed there and to some degree forgotten because of the lack of ability and coordination of what to do with them next. She has literally rolled up her sleeves, staffed people to make change, work collaboratively and cooperatively with our judiciary, with our public defender, our state attorney, with all the stakeholders to make a difference. You will hear not only is the Forgotten Floor shut, but what is happening now at her facilities. With that, Director, come on up. And I would like to tell you, the injury on her arm is because she was revisiting her youth, not an on-the-job injury. Welcome.
I'd like to say that Commissioner twisted my arm to be here, but that's not the truth. Mary Del Guevara, Director of Miami-Dade Corrections and Rehabilitation Department. It is quite an honor to be here. If I had to run a jail, this would be the place I'd run it, because from the judicial system, Judge Soto, Judge Safey, unbelievable, public defender Carlos Martinez, my law enforcement partners, this is the place to be because there is collaboration. Without collaboration, it's not going to work. Our population at one point, when it was about the forgotten floor where we kept our mentally ill housed, was about 7,300. We have gotten down to a population of lower than 5,000, about 4,500. And that's a lot of has to do with collaboration with our judicial partners, with the public defender, pushing to try to get folks that don't necessarily have to be in jail for the intent. Now we have a population of about 2,500. Out of the 4,500, 2,500 have some kind of mental illness. That's a lot. Out of those 4,500, about 500 of them are very acute mental illness issues. We've been able to shut a facility down, but our facilities, we have 2 facilities that were built in 1958. We have some other facilities that are reaching 10, 15 years old. An average jail, 30 years is what you get out of it. So we're working with very old facilities, and we're making strides. But the important thing is these folks, we need to separate them. The ones that don't belong in jail need to go somewhere where they can get help. In addition to that, once we're able to stabilize them, if the services aren't out in the community, you talk about insanity, it's going to come right back again. So the collaboration is so important, and I am so proud of this community and my partners that I'm ready to keep doing what I need to do to make this action happen. And I can't thank enough everyone that's involved. We've put in a lot of work. We've renovated, and I invite anyone to come to now it's the Turner Guilford Night Correctional Center, where we've renovated at least 3 units to make them more therapeutic. We have yoga, we have art classes. Once again, this is something we're doing to improve the environment, but once they're released, there has to be the connecting services. We've actually developed a CIT program for our officers geared towards corrections environment. And that's 40 hours, and we've trained at least 500, and we expect to train the rest of our staff, including corrections health staff, which is the medical provider for our facilities. So all that's important, but again, the most important part is working together collaboratively to make sure that on the front end, we're not receiving folks that we don't absolutely have to receive, and on the back end, that those individuals have that connection, that continuity of medical services when they're released, where to go, how to get help, how to continue with their treatment. And if not, we'll be back in the same revolving door. So thank you for your time, and it's an honor.
Well, Director, you and your staff really have stepped up. They took the principles of this and put it into application, and it makes a world of difference. I would like to tell you the great population diminished for us who are bean counters in government. The cost of a facility to run it and resource it is significant. So when you talk about reducing the population by thousands of who's locked up, that's significant. I'm not sure if I'm stealing Judge Lifman's win, but you have representatives here from different police departments. We did a data study of 1-year control group of 2 departments, the city of Miami and Miami-Dade County. 10,626 signals where officers responded for issues related to mental illness or people with mental illness. These CIT officers on the streets in our everyday environment assess the situation. 10,626 situations, 9 people arrested. That says we collectively work. So thank you to all the principals, the stakeholders, the resources, and the departments. You do make the difference. We didn't take back the money. We reallocated to better uses, including treatment and stepping up. With that, I'd like to introduce you to one of my favorites to pick a fight with. I tend to energize, he tends to calm down, and I stand right next to him and make sure he gets what he wants. Judge Lifman is on the 11th Circuit. He is an associate administrative judge. But if you can relate to his issues and priorities, not just locally, and not just in the venue of the criminal justice system, but in our community, or even on the state, Brian, or the nation, Matt, and to all our stakeholders. He makes the difference. You want to say it's synonymous with mental health. I think it's making sure that people who need to be put someplace for our public safety are done properly, and the rest are treated so they could be part of us in the general community. With that, my friend who is wearing the second hat of representing the American Psychiatric Association Foundation, as well as our premier judge for mental health when it comes to the 11th Circuit, Judge Steve Lifman.
Thank you very, very much. First, on behalf of the American Psychiatric Association Foundation, I want to say how thrilled the foundation is to be partnering with the National Association of Counties, the Council of State Government, and our other partners. This truly is a remarkable day because we all have finally come to the conclusion that it is so necessary for us to reduce the overrepresentation of people with mental illnesses in the criminal justice system. I want to give a particular thank you to Commissioner Sally Hayman, who is a tireless advocate, and you don't ever want to get in a fight with her. And she has really helped make sure that this county has moved us forward and never takes no for an answer. And I'm going to shortly talk about some of the incredible ideas and programs that we have coming forward, and we could not have gotten it done without Commissioner Hayman. So thank you very, very much. I also really need to thank my colleagues, many who are here today and many are working on the bench right now. You know, it's nice to get a lot of attention for doing this, but the reality is that I could not do this without the incredible support of my colleagues. Not only do they back me up when I'm away, they have supported this project and really have made it happen. Judge Faber and Judge Francis handle our mental health diversion court in the misdemeanor division. Judge Safey is one of our key judges in the felony division, and they have taken it upon themselves on how to learn about this issue and how to handle this issue, and they're making a difference in people's lives every single day. So thank you very, very much. I would be remiss not to thank the incredible staff that I have working with me. I tell them every day that they save lives every day, and they do. And they put their heart and soul. They go out 24 hours, 7 days a week to work with this population, to keep them out of jail, to keep them into treatment, and to keep them into services, and help them get into recovery. And we are very, very grateful. And I'm particularly proud today that Miami-Dade County has been selected as one of the 4 kickoff sites in the United States, where we have the opportunity today to truly highlight the successes we've had in dealing with people with mental illness in what I call a true crisis. Surgeon General David Satcher once called mental illness the silent epidemic of our times. But I will tell you, speaking from someone in the criminal justice system, just like law enforcement, there is nothing silent about this epidemic if you work in criminal justice. We hear their screams, we see the horror of the abuse that goes on, and we see them recycle every single day. And it is amazing that our society has allowed this to go on this long. I will tell you, I've been doing this for 15 years, and if we treated people with primary health care needs the way we treat people with mental illnesses, not only would there be serious civil lawsuits, there would be criminal indictments for gross negligence. So it's time that we finally make a change and handle this as it is, an illness, and get people the treatment that they need and deserve. Miami is very unique. We have the largest percentage of people with mental illnesses of any urban area in the United States. It is almost 3 times the national average. 9.1% of our general population lives and often suffers with a very serious mental illness every single day. And because, unfortunately, Florida is either 49th or 50th per capita in mental health funding, depending which study you look at, combined with these high numbers, our jail by far has become the largest psychiatric facility in the state of Florida. And that is a shame, and it needs to change. 15 years ago, through a remarkable collaboration between all the stakeholders who are in this room today, we came together and embarked on an astonishing journey to make jail the last resort for people with mental illnesses, not the first stop. And this phenomenal group of people who are here today helped us develop what we now know as the 11th Judicial Circuit's Criminal Mental Health Project. The project includes some very essential, important key components. The first is our very robust Crisis Intervention Team Police program. Commissioner Hayman already mentioned, we have over 4,500 police officers trained at all 36 police agencies in Miami-Dade County, and many of them are here representing their agencies today. We have a post-arrest diversion program for misdemeanors. If you're arrested in Miami-Dade County on a misdemeanor with a serious mental illness, within a couple days, you're assessed, you're transferred, you're put into treatment, and we help you back into recovery. The program was so successful, we expanded it to a felony diversion program, where similarly, we assess people, we get them out of jail for the nonviolent felons, and we get them into recovery. We've also set up an alternative forensic competency system, one of the first in the United States. Instead of wasting all of our resources to just restore people to competency so we can see them walk back out into the street without services, we're now emphasizing as much helping people reintegrate back into the community. We've started a program to help expedite federal benefits. So when people are leaving our jail, they have their housing, they have their appointments, they have their needs met so that they could get treatment. I would be remiss not to mention John Dow and the South Florida Behavioral Health Network, as well as our partners at the Department of Children and Families, who have truly stepped up to work with us to help make this happen, and they are helping save lives every day as well. We have an outstanding staff, I already mentioned, but it also, our staff includes 7 peer specialists. Those are people with mental illnesses that work for us in this project. 4 of them are actually graduates of this program, and you'll get to hear from one today. And they really are able to make a difference in ways that none of us can understand, but how they are really helping people get their lives together. We've also realized that we have to move upstream. Why are we waiting for people to grow up sick so they end up in the criminal justice system? We've started a program with the school board called Typical or Trouble, working through the American Psychiatric Foundation, where we are now training every single elementary, middle, and high school teacher in the Dade County Public School systems to be able to recognize signs and symptoms of serious mental illnesses so that we can bring services to kids so they don't have to go through their adolescence ill, but they can get into recovery and stay out of our system. Our outcomes have been remarkable. Commissioner Hayman already mentioned that Miami-Dade and the city of Miami handled over 10,000 cases with very few arrests. But I also have to mention, as a result of this training, police injuries have almost stopped. Police shootings of people with mental illnesses has almost stopped. We went from 1 shooting a month in this community of someone with mental illness to maybe 4 or 5 in the last 7 or 8 years. And it's all due to the great credit of our law enforcement who have really already stepped up in our community. Our misdemeanor diversion program has reduced our recidivism rate among our mental health misdemeanor population from 72% to 20%. It is phenomenal. Our felony diversion program is holding a recidivism rate of about 6% for the population that completes the program, which most of them do. That program alone over the last 5 years has saved Miami-Dade County between 35 and 40 years of jail bed days. The forensic alternative program we have is holding almost a 0 recidivism rate because instead of just trying to get someone competent to stand trial, we're helping them with a warrant handoff back into the community to get into recovery. All this has contributed, as the director mentioned, our jail audit dropping from about 7,500 to 4,500. We actually closed the jail a couple of years ago as a result of all this good work, actually saving Miami-Dade County $12 million annually that can be spent in a much, much better way. Right now, our jail spends almost $218,000 a day to warehouse people with mental illnesses. That's a cost of almost $80 million to our county. It's wasted dollars that we could spend in a much, much better way instead of doing that. In an effort to further improve our efforts, we are developing the first of its kind forensic diversion facility over on Northwest 7th Avenue and 22nd Street. We're taking the old state hospital, it's 180,000 square feet, and we're going to turn it into a facility that's a one-stop shop for people who are extremely ill that keep recycling through our system so we can get our arms around them and help them recover. There'll be a courtroom in there, there'll be a crisis stabilization unit in there, there'll be a short-term residential facility. There'll be a primary health care unit along with psychiatric care, so we can do what we call a medical home model to deal with everyone's full illnesses, not just their psychiatric care. There'll be a day activity program in the facility run by people with mental illnesses for psychosocial rehab, and we will be putting a culinary supportive employment program there to help people get jobs when they leave. All the essential elements for recovery will be in one location, and it is a remarkable comment on our county for stepping up and the taxpayers who passed a $22.1 million bond issue to help us open this facility. And finally, we are working with Otsuka and IBM to develop the first of its kind in the world to use advanced technologies to help eliminate all the fragmentation in our community mental health system, where the system will add accountability, where the system will develop treatment protocols, where the system will help us develop a preventative system of care so people don't have to get arrested or hospitalized to get treatment, but we can get to them early enough to really help them into recovery. Our hope is that these new services with the advanced technology will finally begin to treat mental illness as it should be treated, as an illness and not a crime. Thank you very much.
I mentioned yesterday that we passed a resolution, my colleagues and I, unanimously, to support the Stepping Up initiative of our national friends in NACO and locations across the country. This initiative will result in the reduction of the number of adults with mental illness in our county jails. Director, we're on notice now. I look forward to this time next year shutting another facility. And Steve, I can't wait to open up your forensic site. It is a one-stop shop dealing with people that have mental illness. And a bit of irony, you're in the new children's courthouse. This is the one-stop shop for children of all needs in our system and everything related to them and the service providers in one building, so it can be done. Thank you, Judge and stakeholders. With that, now, I'd like to bring up our national partners. We have a proclamation, sort of a little bit of formality. Come on, we'll stand over here a sec. This is our commitment to Stepping Up Initiative Day, and Miami-Dade County is leadership, is on board, and we're a team player. So with that, thank you for including us here.